Serious. Doctors of Reddit, what is the most stupid thing a patient has said trying to correct you? Story 1. Patient comes in with abdominal pain. I think it's my gallbladder, they say. Looking over their chart, I see their gallbladder was removed 20 years ago, so that is impossible. I mention this, to which they reply, yeah, but it grew back. Edit. Yes, I know there are a number of other things it could have been. A retained stone crossed my mind, but after 20 plus years I found this unlikely. She also had the scar to vouch for the surgery. There was definitely a psychosocial element to this case. Story 2. Ophthalmologist here. Told patient he needed reading glasses, which he didn't believe. I explained that everyone develops presbyopia eventually. Come on, George Clooney doesn't wear reading glasses. A. Yes, he does. And B. Not sure why you are comparing yourself with him. Story 3. Had a female patient. Her mom asked me to adjust her. Trying not to burst out laughing, I said, "Your daughter's." She acted like I was stupid and pointed to the back of her neck. I knew she wouldn't listen as she was so convinced, so I stopped arguing with her. And I also wanted her to go around saying it to other people. Story 4. I work in a burn ICU, which is a weird little specialty, but the number of patients and visitors that come in knowing absolutely everything is annoying, as mayonnaise, mustard, and butter are not acceptable burn treatments. Leave the condiments in the fridge. I do not appreciate having to scrub 3 jars of mayo off grandma. I had an incredibly sick patient with large burns and ARDS, a serious respiratory complication that makes it very difficult to oxygenate someone, even with maximum settings on the ventilator and continuous medication to open up the lungs. He was then put in a rotating bed that we bolt patients into and rotate them face down. He was also on continuous dialysis from sudden kidney failure. Anyway, so patient sick as I had 10-12 IV bags going at once. Just a general shit mess of a person. Here comes the family member with medical experience. These are the worst. They always end up being a transcriptionist or a nursing assistant at a nursing home or some, but they enjoy coming in and trying to run the show. Some highlights from medical expert before I kicked her out of the unit. Why aren't you paying attention to his brain waves? Yes, she yelled everything. She was pointing to the display on the ventilator, which has everything to do with breathing and nothing to do with the brain. Why isn't he on propropanol? It's negligent to not have him on propropanol. She meant propofol, think Michael Jackson, but he was on ketamine and versed because those worked like a charm for him, and propofol was having some unwanted effects on him earlier. The dressings are dirty, you need to change them immediately. Okay, right off with this. 1. It takes at least an hour or so to change a full-body dressing while they are in the rotating bed. And the patient was so sick that if we rotated him from face down to face up to get the dressings on his front, the fluid shifting in his lungs would likely have killed him. Also, burn dressings get gross quickly. I was super fucking irritated by the time I kicked her out. Never kicked anyone else out since, but she was annoying. Bonus. Since you're reading, here's the kind of injuries that should be seen in a specialized burn center, according to the American Burn Association and some paperwork my boss gave me and I lost. 1. Partial thickness burns greater than 10% total body surface area, TBSA. 2. Burns that involve the face, hands, feet, genitalia, perineum, or major joints. You're going to want a specialist to repair your face and bits. Trust me. Also, since scars do not stretch, joints provide an issue. 3. Third-degree burns in any age group. Third degree requires surgical involvement. 4. Electrical burns, including lightning injury. Electrical injury can cause severe, hidden internal injury, as well as shitty heart rhythms. 5. Chemical burns. Okay, honestly, I always call poison control for backup because you people get into some weird stuff. 6. Inhalation injury. As you already know, burns swell and blister. Burns to the airway are just the same, and without intervention, the airway can swell shut. 7. Burn injury in patients with pre-existing medical disorders that could complicate management, prolong recovery, or affect mortality. Diabetes. 8. Any patient with burns and concomitant trauma, such as fractures, in which the burn injury poses the greatest risk of morbidity or mortality. In such cases, if the trauma poses the greater immediate risk, The patient may be initially stabilized in a trauma center before being transferred to a burn unit. Physician judgment will be necessary in such situations and should be in concert with the regional medical control plan and triage protocols. Pretty self-explanatory. 9. Burned children in hospitals without qualified personnel or equipment for the care of children. Kids are not just small adults and require a fuckton of their own equipment. They are also still growing. A problem when scars do not stretch and grow with them. Story 5. Had a patient come into the ED for what was essentially a cold. Kept requesting antibiotics, kept explaining that they wouldn't help her viral symptoms. But I did then sit down and give her a basic tutorial on the differences between bacteria and viruses, and antibiotics and antivirals. Hopefully it was enough to help her in medical school finals the next week. Edit. Thank you for all the upvotes. I have surpassed my husband on his upvotes. Story 6. The time I was telling the family that the patient is going to die, and her lab results, pH 6, lactic acid 25, are not compatible with life, and they said they were pretty sure she would wake up if I put ice in her underpants. Well, yeah, we are not going to do that. She died, and they still didn't believe me she was dead. They kept trying to wake her up. Story 7. I introduced myself to a patient as doctor. You're anesthetist. Patient said that I could not be a doctor as anesthetists aren't doctors. Not long after, another patient asked me if I had to go to uni to be an anesthetist, and still another asked me if I had to know as much as a pharmacist. Edit. The number of patients I have seen who are acutely unwell because they stopped their medication does my head in. Almost always the reason they stopped the medication is because the condition they were taking it for went away. As a result of the medication. SMH. Story 8. Mom of baby. I don't vaccinate, it's against my religion. Me. Oh, really? Just out of curiosity, what religion is that? Mom. I'm Catholic. Not really a correction per se, but made me laugh a lot. Story 9. Am a doctor, but this was my nonna, not a patient. She was drinking 11 cups of coffee a day, which is too much. We held an intervention while visiting for dinner, and when we told her she was addicted, she responded, No, the coffee is good for me. It helps me with my shaking. She cut down once we explained to her what drug withdrawal was. Story 10. I had a patient once with family members who were some of the most frustrating people I've ever dealt with. The patient was morbidly obese and had open sores and wounds in all her skin folds. Cleaning her when she was first admitted was like some sort of disgusting clown car. We found a floral pillowcase shoved under one fold and what we think was a smashed bread crust in a fold near her groin. Anyway, because of her weight, she wasn't a candidate for surgery and therefore there was nothing our team could do for her. I think about 5 or 6 different meetings were held with her family to discuss her prognosis. Her daughter told the attending physician he didn't know what he was talking about and that she had been this sick before and pulled through. Her pH was so low it just read as 6-8, and her blood pressure was a solid 60-25 despite every vasopressor under the sun running at 3 times the max doses. When the charge nurse pointed out her blood pressure on the monitor, the daughter said, "Psh, I've seen lower." When she finally died, her family was livid that we didn't save her. We coded her for 20 minutes, and they told us we should have continued for at least an hour. I felt terrible that her last days were spent in such torture, all because her family was in such denial about her condition. Story 11. I asked a patient complaining of dizziness if she had ever been diagnosed with vertigo. The daughter chimed in and said, No, she's a Libra. I then laughed hysterically at her awesome joke. She was dead serious. Story 12. Probably the legions of women that seemingly don't know how long it can take for an IUD to work and want it taken out because it didn't instantly stop their periods within a month. Also the women that come in with chlamydia but deny having had. Like, come on, I'm not your boyfriend, you don't need to lie to me. Story 13. Doctor here. One we get commonly is, I know my body. Scoped a guy with knee pain. The joint looked perfect. Told him after the surgery and he told us, No, my tendons are all torn. I know my body. Told a lady she was pregnant. No, I'm not. I just had a big lunch. I know my body. Edit. Absolutely. When something doesn't feel right and your doctor doesn't want to listen, seek a second opinion. You know how your body normally feels. But if someone has performed an invasive surgery to look at your joint, or has seen a fetus on ultrasound, they probably know what they're talking about. Story 14. 1-year-old hospitalized with ingestion of unknown drug. No immediate signs or symptoms. Mother says it is heroin from her brother's stash. Urine comes back positive for meth. Mom gets very angry and defensive and tells us it is just heroin, and we should stop accusing her of having meth. Like, lady, why you think letting your toddler try heroin is so much nobler? Edit. Another one I remembered back from my GP days out in the middle of nowhere. Lady comes in with itching of the scalp. I look at her head, and she has matted, greasy, extremely dirty hair that actually smelled. I have seen a lot of dirty people, but it was really something else. She wanted medication. I suggested she wash and comb her hair regularly for a few days and see if it would get better. She said, "And what if I wash my hair and it doesn't get better?" Well, I am sure you can accumulate the filth again in 10 years or something, so it is not a permanent loss. Story 15. Woman with breast cancer. She was in the medical field too, so I am unsure why she said the things she did. Perhaps she was still in denial. IDK. Anyhow, so I was the intern when she came in for a chest tube insertion to drain her pleural effusion. It was obviously suspected to be malignant. After the procedure, I went home, and the resident on call had to deal with multiple calls from the distraught staff in her ward, for reasons I shall explain below. The next morning, I was told by said resident, sporting a haggard appearance and bloodshot eyes from a busy shift, that she was my problem now. With that, the poor man left for home. I go in to see her and first get accosted by ward staff who tell me she legit refused all pain meds right after procedure, which entailed a tube scratching against her parietal pleura. Ow. So I go in and am told, by this woman who, let me remind you, was employed in the healthcare sector, that the tube has been pushed in far too much and is stabbing her, and that I need to undo the stitch and pull it out a few centimeters. No, lady, I'm not authorized to do that. The x-ray was fine. No intervention was necessary. I tell her she needs to take her meds if she wants the pain to get better, and she says, no joke, that pain meds will further spread the cancer, and that I should know that, being a student of medicine. And she further said, look, no need to tell anybody. You're a doctor. Use your own judgment and pull the tube out. Oh, sigh. She was adamant. My professor was going to be late that day, and I obviously wasn't going to do anything without his permission. I documented her refusal and went on my way. She left by the afternoon, against medical advice. I feel bad for her, but she won't letting me help, so yeah. Story 16, gynecologist here. Imagine a revved-up version of that dreadlocked beanie-wearing woman meme. It's not vagina anymore, it's pronounced vagina now. Story 17. Had an extremely frustrating dialogue with one. Took about 45 minutes and got nowhere. The gist: I keep gaining weight even though I don't eat anything. That's against the laws of physics. But it's happening to me. I tried a diet where I ate 800 calories per day for 2 weeks and gained 5 kilos. So those laws don't apply to me. I don't believe you. So you're calling me a liar? I eventually proceeded to tell the person that if they were really generating mass out of thin air, then scientists around the world would want to study the phenomenon. The only time I have ever almost lost my temper with a patient. Story 18. I took care of a child that got chickenpox. The mother was strongly anti-vax but was yelling at me, how can modern medicine not have a treatment for chickenpox? She couldn't grasp the concept that we do. She just refused it for her child. Story 19. Lady comes in with shortness of breath. We check her troponin levels. They're elevated. Ma'am, you're having a heart attack. No, I'm not. Yes you are. No, I'm not. Her PCP came into the ER and fired her as his patient. She signed an against medical advice and left. She died the next day. Of a fucking heart attack. Yeah. Story 20. Veterinarian here. The anti-vax movement has been slowly seeping into my profession for years, but in my area, it's gotten much worse recently. Almost every day now, I have a client inform me on how toxic vaccines are and that I should talk to their dog's breeder because she is very informed. Most of the time, I'm able to convince them that this is incorrect. However, some are still quite resistant. Vaccinating for rabies is not just a suggestion, it is the law. And my clinic has a policy that we don't let any of our healthy animals be vaccine-free. I've had a few clients walk out over this policy. I feel bad for their animals. These are the same kinds of clients that won't use flea and tick prevention on their obviously flea-infested dog, but will use lemongrass and peppermint instead. Spoiler, it doesn't work. Story 21. Might be late to this, but a 17-year-old girl who was pregnant and came into the emergency department to get checked as she was punched in the stomach. She wanted to go out for a smoke, so I did the whole pregnancy and smoking spiel. She stopped me and told me I knew nothing as the baby would be harmed if she stopped smoking straight away. Story 22. Me. Sir, I need to know why you stopped taking your antiretrovirals for your HIV. Him. Well, I met this witch online that. Me. Wait, did you just said witch? Him. Yeah, she sent me a bunch of herbs every month to cure my HIV and they worked. Last time I checked, I was cured. Me. Where and what test did you do to know you were cured? Him. I made an online test that the witch told me to. They were a lot of random questions, but in the end it said that I was free of HIV. Me. Ook. We will need to do a blood test to confirm that. Now can you tell me which herbs were you consuming? Him. I don't know the name, but I have them right here. Points at his backpack. Me. May I take a look? Him. Sure. I opened the bag, and what I saw was nothing but grinded oregano with something that smelled like chlorine. The patient, sadly, died from a severe sepsis a month later, with a highly resistant microorganism. Just because a witch in a website told him to stop taking his meds. Story 23. Radiographer here, and had the ED doctor give me a request for soft tissue neck x-rays, and the doctor was much like, don't question it, just do it. Anyway, after that patient had left the ED, Eider came and told me that the gentleman presented to ED at 3 a.m. because he had hot milk 3 days ago, and his tongue has been hurting ever since. The patient basically burnt his tongue but was insisting on an x-ray to ensure nothing is wrong. Story 24. Woman with this weird abdominal cramping, twitching presentation. I won't say stupid because she probably had some kind of undiagnosed dementia, but definitely the most bizarre. Ask her what she is feeling, why she's twitching her abdomen. It's like it's trying to get out. Like what's trying to get out, ma'am? My sperm. Ma'am, you don't have... Oh. For those of you curious, by the time I saw her last official diagnosis was pseudoseizures. She had a tendency to start twitching parts of her body whenever we would start asking whether she had twitching in those areas. Ma'am, have you had any twitching in your legs? She looks at leg. Leg starts twitching. Yeah, I have. Story 25. Med student here, but I have had 2 winners. When discussing a precancerous skin lesion on a patient, they opted to use their laser ray instead of classic treatment. It was a cancer laser ray that was bought online. It also apparently had frequencies for arthritis. They insisted that the vibratory frequency can be tuned to destroy cancer cells, just like a trained singer may be able to use her voice to break a crystal glass. The patient did not believe that cancer cells and regular cells would have the same frequency. Another patient insisted that his cancer had been properly treated at home with baking soda. He gave me a website like phkillscancer.com or something. The patient also had with them a surgery report in which it appears their baking soda consumption resulted in buildup of abnormal calcium in the wall of the stomach, which had to be removed. Story 26. When I was shadowing in a PEDS unit, a doc told me how a father of a newborn was against vaccines, even Vit K, because he thought the preservatives in them were harmful as he was eating a bag of fucking Doritos. Family came in like a day later because the kid was about to bleed out. Edit, spelling. Story 27. 20-year-old girl and her fiancé find out that she's pregnant partway through taking her history. Do you smoke cigarettes? Her, yeah, about a pack a day. Me, you should definitely stop that. Her, well, my sister told me that if I stopped smoking, the baby would go into withdrawal and die. Me, what PSA? Don't smoke if you're pregnant or planning on becoming pregnant. It's never too late to quit. Story 28. While I am a doctor, this happened to my wife, also a doctor. Female PT came in complaining of infertility. Said she and her partner had been trying to conceive for like 5 years and had tried everything. At one point, she let the pronouns slip, she and I. And my wife said, wait, let's back up a minute. Turns out the woman had been in a hetero relationship for a few years and never got pregnant despite using no protection. She then entered a same relationship and again never got pregnant even though she really wanted to, leading her to believe she was infertile. When my wife tried to explain that conception requires, sourced from a male, as well as an egg, the PT was incredulous and exclaimed that she didn't need a man in my life, and she didn't like being judged. Perhaps needless to say, the patient was lost to follow-up. Story 29. Med student, but a patient was telling me about how a doctor suggested she may have shingles of the eye, trying to get me to laugh at the other doctor because apparently shingles of the eye is a ridiculous concept. You can totally get shingles in your eye, though. Story 30. I'm a registered dietitian nutritionist. I was counseling a patient who was morbidly obese, diabetic, and had severe peripheral neuropathy. He was also a chiropractor who had a hard-on for homeopathic remedies. I couldn't get out a full sentence without this guy trying to tell me that a dilution of whatever the would do the exact same thing. Finally, I just said, "Look, doctor, you need to cut the sugar and eat something in the vegetable family with every meal. You can drink whatever potions you want on top of that. But 30 years of drinking your distilled water has landed you here, in my office, with a broken pancreas and no feeling in your feet. So let's give this a serious try unless you want to take a chance with your flower remedies when the heart attack or stroke hits." Edit. Since a few people have asked, he got highly offended and filed a complaint with our VP of Patient Relations. I was ordered to some bullshit sensitivity training where I was told that I should have listened to his opinion on care and validated him as being heard. I was also told, by at least 3 non-clinicians, that since he was a chiropractor, I should have given more weight to his opinion since he was a licensed healthcare provider. I finished the training and promptly began looking for a new job. Story 31. I am a family practitioner, and I had a family not want to vaccinate their newborn because they heard that vaccines were derived from monkeys' brains, and they didn't want their child to develop monkey-like characteristics. Story 32. Me. Your blood pressure is very, very high. You need to take the blood pressure medications I prescribed you. Him. I don't need no pills, doc. All I need is Jesus. Story 33. When I was a medical student, this middle-aged male patient from a rural area got it in his head that I knew absolutely nothing, and he was doing me a service teaching, talking to me. He was in colorectal clinic for something unrelated and started telling me about the gland on the back of his neck that would drain every so often. When he saw that I was unfamiliar with this particular gland, he gave me this knowing look, laughed, and started instructing me, the dumb little medical student, about this gland. Apparently, everybody has this gland for the immune system, but that his would drain when he was stressed. No, sir, I was being polite, but you have a nasty fucking abscess on the back of your neck. I was hoping that the patient would try to explain this medical wonder to my attending when he came in. But alas, he didn't. Story 34. A mother brought her 14-year-old daughter to the ER due to hypogastric pain and spotting. We asked the daughter when was her last period. She said 2 months ago. We asked her for her sexual history, thinking this might be an ectopic pregnancy. The mother kept butting in, saying that she is still a virgin and she has no boyfriend. We left it at that until her mother went out to go to the bathroom. The patient admitted that she had sexual intercourse with a classmate of hers. We requested for pregnancy test and HCG titers. It really looks like ectopic pregnancy. We advised the mother that her daughter needs immediate surgical intervention. She refused to believe us, saying that the lab results are unreliable and untrue. She keeps on saying that her daughter is a virgin. She stormed out of the ER with her daughter that looks really in pain. Story 35. Had a patient with atrial fibrillation that needed to be on anticoagulation. I chose Pradaxa, and patient said, "No, that one does not have any antidote. In fact, it's the only new oral anticoagulant that has an approved reversal agent." Patient refused to believe me, like I got some bonus for killing her or something. Story 36. Woman had a bad yeast infection. Besides that smell, I also smelled feces. I asked if she wiped back to front. She said, "Yeah, but that's not why I have this, it's from drinking pop." Despite my assurances that it was not from drinking pop, she wouldn't believe me. I said, "Okay, you must be right, I'm just a doctor," and prescribed her the same thing I would have if she was an intelligent person. Story 37. Patient stated he got a full fellatio at his previous hospital before being transferred to my hospital. Not sure if he was trying to say filleted, in regards to debridement of his lower extremity wound. Story 38. I'm a med student, and my mom is a nurse, but this is about my grandmother. My grandpa is in his 80s and recently had his second back surgery. My grandma is in her 70s and is his only caretaker. The reason? She knows everything about medicine ever. After grandpa's first back surgery, that was shortly after a knee surgery as well, my mom flew to my grandparents to help my grandpa the first couple weeks of recovery. He needed some extensive help with PT and lots of trips to the doctor about an hour away. So a younger set of hands that was used to this was extremely needed. But grandma didn't think so. My grandpa takes about 8-10 prescriptions daily, all of which my mom has extensive knowledge on. My mom wasn't allowed to touch his medications, give them to him, or remind him when it was time for his next dose. She couldn't help him out of his recliner, bed, or to the toilet and shower, wasn't allowed to help him with his prescribed physical therapy, couldn't make him food, and couldn't help clean his sutures. The way she described was that she was 5 years old again. Why did her mother act like this? Well, since my mom took 6 years to get her nursing degree, she's obviously not fit to be a nurse. Never mind the fact she's been working in the field for 25 years, is the leading nursing authority at her current job for the past 10, and is currently going through another RN program simply to learn the new advancements that have come about. My grandmother is older than her and has dealt with her husband's issues longer. She's the main authority on his health. She also told me that going into physical therapy was a waste of my money because she never needed PT before, so who does? Story 39. All the ones I can remember follow the same theme. Patient misunderstands the difference between correlation and causality. The most striking example was a young man who was dying of AIDS. "Doc, I was never sick a day in my life until y'all started giving me all these meds." Well, sir, while you still had a functional immune system, you didn't need these meds. HIV is a treatable illness these days if you actually take the drugs. If you believe the drugs are the problem and not the virus, well, you can still die from it very quickly. Variations on that theme are very common, unfortunately. Story 40. I had a father bring in his 8-year-old son, who had a bit of a cough. Checked the boy's temp, which was 36.9 degrees Celsius. This is a perfectly normal temp. Father argued with me for 10 minutes, stating his son usually ran at 36.5, so this was apparently a fever, and he needed to go hospital. Tried my best to educate, but ended up asking him to leave as he wasted 25 minutes of my time. Story 41. I've had a few patients express dissatisfaction that their Botox only lasted 3 months, and they suspected that I was diluting the Botox. Both statements are absolutely true and consistent. Story 42. I can think of 2 cases. One involves family members instead of the patient. I had a patient who had a simple L4-S1 fusion. Did great post-operatively. Went home and hippie daughter introduced some allegedly probiotic therapy to speed healing, which actually introduced bacteria into the surgical site. 3 weeks later, we took him to the OR emergently to remove the hardware, and he spent 6 weeks in the hospital thanks to the massive staph infection introduced by a hippie. The other was a naturopath witch doctor brought into our ED, initially unresponsive but regained consciousness. He had a ruptured MCA aneurysm. He insisted we try some alternative bullshit to shrink the size of the bleed and heal it naturally before we would try the OR. His naturopath friend came in to do something while we took another patient to he OR. Went to convey the seriousness of the situation, and he went unresponsive again, about 2 minutes after I left his ED room, to which we invoked an EM caveat and took him to the OR for definitive repair and clipping. He's now the naturopath who saved 5 lives thanks to organ donation. Edited for a misspelling. Story 43. Anything said after WebMD says, I tune out. Or drug seekers who tell me, pain is 10 out of 10, I need Demerol, but are sitting up, talking, or going for a smoke while waiting. Frustrating. Story 44. Paramedic student here. Not the most stupid thing I've encountered, but the most common stupid thing. Do you have any pain anywhere else? Nah, all good. Then what do you take this specific medication for? Oh, that's for my back pain. Or any past medical history? Nah. Ever been to hospital? Nah. Have you had a heart attack before? Yeah, how do you know? Has a massive personal medication bag to do with cardiac meds. Story 45. This may be super off topic, but I've got a few stories from a veterinarian's office. First off, plenty of people confuse heartworms and intestinal worms, But I'll give you a hint. Heartworms are in the heart, and intestinal worms are in the intestines. So occasionally I'll get the people who want heartworm treatment because they saw worms in their puppies. Totally normal for puppies, BDW. So we'll have that conversation, but recently I did have the reverse where a woman had a 6-year-old outside dog who has never been on heartworm prevention. Heartworms are spread by mosquitoes, and we live in the American South, so the only way to prevent them is round-the-clock prevention for life, usually a monthly pill. So surprise, surprise, dog has heartworms. Lady doesn't want to pay for treatment, which to be fair can be extremely expensive. However, months later, she calls upset that her dog has died, even though she did what the doctor told her to do. So I check out the notes from the app. Doctor told her the dog needed treatment, or at the very least, a slow kill method of a monthly pill that doesn't actually work that well but is better than doing nothing. Turns out the woman had been buying homeopathic tapeworm medication over the counter because it was cheaper. The most recent, though, I had a woman come in just because she hadn't brought the dog in for a while, and also he started peeing in the house at the age of 8 years. This happens for a number of reasons, but this woman, for God knows what reason, wanted a fecal test to be run. We said we could do one if she wants, but we'll still need a urinalysis for the urine problem. Then she became belligerent. No matter how many times we explained that a fecal exam is not going to tell us anything about the dog's urine, she legitimately did not understand why until the doctor looks her straight in the face and says, "The poop is from the ass, the pee is from the penis. They are not related." Then she got it. The most stupid thing anyone has ever done, though, is actually terribly sad. It breaks my heart every time I tell it is about puppies that didn't survive, so please don't read further if you can't handle it. An adult man came in with his mom one day with puppies that just were not right. They were occasionally vomiting white foam, and when they weren't vomiting, they were crying nonstop and running into walls. We learned through the course of the discussion that the guy had allowed his 2 4-year-old labs to breed in his backyard to make some extra money on the puppies. But neither dog had ever been vaccinated, and neither had the puppies. They couldn't pay for any testing, but the doctor told them it looked a lot like distemper, and the puppies most likely would not last a week. He got very upset because the last puppies his dogs had got parvo, which is at least has a chance of recovery. But the girl at the pet store told him bleach could kill parvo, so he made all the puppies drink it. I had to leave the room to vomit, and I still cry about it. He didn't have a disability or anything, but even if he did, his mom was with him and should have known better. That's honestly the dumbest patient I've ever had. It's just unfortunate that stupidity kills. Story 46. When I was about 16, I went to the hospital with sharp pain in the lower right-hand side of my abdomen. It seemed pretty serious, so both of my parents were with me, which was unusual because they're divorced. A doctor looked at my symptoms and said it looked like appendicitis. I groaned, "I don't have an appendix, it was taken out." My parents said, "Yes, you do." When I was 6, I had surgery to correct testicular torsion. I kept both my testicles. My parents politely told people I had my appendix taken out to explain why I was in the hospital. I accepted this as the actual reason for my surgery, so years later when I learned the location of the appendix, I assumed they did some kind of laparoscopic surgery to explain the scar there. I was very surprised to learn that I do in fact have an appendix. The pain turned out to be from a sharp piece of chicken bone. Story 47. Patient. My husband died of Agent Orange cancer. Me. Oh, I'm sorry for your loss. Where was it? In his lungs. Did he smoke? 2 packs a day. I didn't argue. There is a really strong psychological need for people to find external forces to blame for their misery. Story 48. A mother in a pediatrics office asked me during a well-child check if I agreed sunburn was better than those nasty chemicals in suntan lotion for her kid. Story 49. Had a 2-year-old boy crying in pain in the ER. Mom says he's having trouble learning to use the toilet. During exam, I notice his foreskin ballooned out and the opening at the end was dripping a little urine at a time. Felt his bladder, and it was full. Diagnosis. The kid was full of urine and had phimosis so bad that it was preventing the urine from coming out. I said that he needed an emergency circumcision. The mom, who was the closest thing to a modern flower child that I'd ever seen, tried to tell me I was wrong. "He'll grow out of it," she said. All this time, the kid is screaming in pain. I eventually got the grandmother involved and called the kid's father. After 3 hours, the mom finally gave in. Story 50. A woman in her 60s came in to see me for shoulder pain and was adamant that a chiropractor had flipped her clavicle around using his clicker. By her description, she thought it had rotated 180 degrees around its long axis, and she wanted me to flip it back. She had rotator cuff disease but would not believe me. After 3 visits, I finally told her that there was nothing I could do for her. My office manager called her crazy shoulder lady. Story 51. Families are the worst. But regarding patients, we had a heroin addict who was admitted due to bilateral open tib-fib fractures. He had to wait a day for the final operation to fix his fractures because our operating theaters were out of order. He insisted on signing himself out, and that he'd just keep it clean and walk it off. Never came back. Story 52. During residency, when I was working in the ICU, there was a patient dying of end-stage hematological cancer. Can't recall which type exactly now. With ARDS, renal failure, sepsis. The patient had very clear goals of care and did not want CPR. When I called the family to come in very early one morning as we felt the patient would die imminently, they proceeded to insist that if I just let them put Manuka honey through the patient's G-tube, then she would get better. I had to repeatedly tell them that all of the patient's organs had failed despite all treatments they had been willing to undergo, but they were fixated on this magical honey cure. Very sad.